Hi everybody, I'm Melinda Gallant and I want to welcome you to another Cape Conversations. We've got a great show today. It's about something that's going to be on the warrant for this May town meeting here in Sandwich. It's a very important topic, so come along, let's have another Cape Conversations. Hi everybody, I'm Melinda Gallant. I want to welcome you to this edition of Cape Conversations. Very excited to have with me two gentlemen to discuss recreational marijuana that's on the warrant this year and will be coming up in May at our town meeting. We need to get the real facts about this, so I have invited to discuss this David Noble and Adam Higgins. And Adam, you're the community person, right?
Yep, been advocating here on Cape Cod for cannabis last 6 years or so.
Wow, that's great. And David, you own the medicinal marijuana place.
In good health. Yep, happy to be back. Nice to see you again.
Yes, and here's the big news. I went there before. I saw your beautiful offices there before and how you sell it and all of that. And he never gave me any samples. And it was wonderful to see. It was clean, it was attractive, and now you want to sell recreational marijuana out of there.
That's what we'd like to do. The medical marijuana dispensary has been very successful. A tremendous amount of local residents come to see us, which is great. And we have an opportunity now to expand this business to adult use, is what we call it,
right.
Recreational. And this will give the residents in the town a chance to shop locally. It'll give us a chance to hire more employees. But most important, it's going to give us the opportunity to give the town back somewhere between $750,000 and $1 million a year between host agreement and tax revenue.
To go into our general fund.
Go into your general fund. It's
yeah.
These opportunities, I don't think they come often. It's a very unique business. It's very regulated. It's very controlled. We've had no issues. We've had no police, no fire. And we'd like to expand the opportunity in a controlled manner.
It seems simple enough. So Adam, your role is to sell this to the community, I think.
Well, yeah, I mean, I'm an advocate generally, so I mean, it's hopefully not such a hard sell, like David says. I mean, this is a rare opportunity to add a whole category of revenue, to the budget. I mean, if you check and if you look at it, it was any property owner knows it's very heavy on taxing, property.
Mm-hmm.
We need business revenue coming in. To put it in comparison, all the hotels in the entire town, all the room occupancy tax comes in at about $399,000. Right?
I know. Well, there are many rooms.
Right. So I mean, this is like doubling that, double our entire room occupancy tax base. I mean, that's a rare opportunity to do something so large.
So I think some of the reason why people go, no, not in my town. Yeah. They're afraid that. Johnny, 12-year-old Johnny, is going to ride his bike.
Yeah.
Of course, I wouldn't let any kid ride their bike on 130 personally, but ride up 130, go in and say, hi, I'm 18, he's 12, and buy something. Tell me that won't happen.
Well, that's definitely not going to happen. I mean, David could speak more to the operational procedures that prevent that. But I mean, first off, it's 21, and nobody gets in the door without a valid license, and it gets scanned, and so you can't even fake it like I used to when I went into liquor stores when I was in high school. I had a nice fake ID, but all
my son had one from Alaska.
Right, but now you're scanning them. You can't. My whole strategy wouldn't work today. Right. So there's lots of protections in place, and I would say the really it's much easier for there's been a few surveys around this. It's easier for high school students to get cannabis on the illicit market than it is for them to get alcohol legally. So we would say put that cannabis in a similar controlled environment, right? That's how to get it out of their hands. Like if we truly want to,
So
limit
what
their
happens?
access.
What happens to the bad stuff? The stuff that's sold on the black market.
Right. So I mean, they're trying to be competitive, right? So
right.
the idea that the effects are going to be different. There's they lace it with different things. It's not tested. It's it's not regulated, right? So what we see is a lot of products, counterfeit products, of West Coast products, things like that. And that's really where I started as an advocate on the Cape, just letting people know that, like, hey, before you ban this here, like, it's already here. You know,
Right.
you can order it online, get delivered to your home. So that's, you know, really.
And you don't know where it's coming from.
You have no idea where it's. There's no testing. It's just whatever that person decided to put on the label and tell you it's in it, right? And you know.
Right. So that's scary.
That doesn't sound safe. That's very scary.
Yeah, it's very
exactly.
scary. And you live here in town, right?
Yep, live over here in Lakewood Hills.
Yeah.
Yep, with my wife and 3 boys. So,
Right.
You know, yeah, I'm a cannabis entrepreneur as well. So, you know, the idea, you know, we've been blocking bans and we're, you know, helping towns, you know, embrace this cannabis opportunity. So, you know, I'm actually opening a store in Orleans.
Yeah.
You know, but I live here in Sandwich. So,
Yeah.
you know, like.
That's a commute.
I want, you know, that's a commute one. Also, I want, you know, I'm also a medical patient myself. So I you know, frequent David's store.
Right.
You know, I would rather, you know, more local choices, you know,
Right.
and ultimately let's get more revenue coming to Sandwich, you know.
Sure. Now, did Orleans overturn theirs as well?
Right, so similar situation where they banned retail and we had to get a 2/3 majority at town meeting
I
to
see.
reverse the vote. So similar, you know, that's exactly what needs to occur here.
I see. So, how's it going to work?
So the way it would work is on the May 2nd vote,
Yeah?
if the town residents feel that this is a good
So
opportunity.
is this on a ballot
This
or is it
Yep.
town meeting?
No, it's a ballot.
So it's going to be on the
Citizen
ballot.
referendum, yep.
Okay. So because it's a citizen referendum, we have to go to vote on this.
Correct.
It's not a town meeting 2/3, you know, raise your hand. It's not that. It's going to be on the ballot.
Oh, so it will be, it's on the, it's a warrant article. It will be, you know, voted on at town meeting in a similar
It will be.
method.
Yeah.
So what if it passes at town meeting? Then do you still have to vote for it? Yes?
No,
No.
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 That is
No.
the vote.
Yeah.
That
town
is the
meeting.
vote. Okay. That's what I want to
So
make
there's two
sure. So if we
pieces
go to
to it.
town meeting, we can.
Yep, you have to be a registered Sandwich voter.
Yeah,
And you'll
yeah.
have an opportunity to vote, and the first piece of the vote is whether or not to make the zone, the overlay district.
Right.
To convert that to a co-located district.
Right.
Yep, to allow
Which
it.
would allow both medical and adult use. That's
Right.
piece one.
Right.
That's a zoning piece.
Right.
The second piece is the actual warrant for or against adult use.
I see.
We've seen a few towns down in the Cape overturn this since
Yeah.
the 2016 original vote. And I think you're going to start to see more and more towns, because what they're seeing is residents in their community are
They're going
driving
somewhere.
right through the community, giving their money to a neighboring
Right.
town,
Right.
taking their
Right.
legal marijuana and driving back to their community.
Right. Well, well, I'm a marketing person. Okay. So I mean, I did it for many, many years as part of my job. So for you to be right off the highway in the summertime to having these people come down,
Yeah.
not a bad thing.
Not a bad thing, and you know, we've done our traffic studies.
Yeah.
The interesting thing is Route 130 is a busy place.
It
but
sure is.
There's never been an accident at our location in the history of the building.
Yeah.
The accidents have been reported on the on-ramp.
Yep.
Or off-ramp.
Right.
So, you know, we're expecting an increase in traffic, but not to the point where if you were to fill our office building with medical professionals, they would outdo what we're
you're
about
doing.
to try to do.
Sure.
Yet we'll be giving an enormous amount of tax revenue and increased host agreement fees back to the community, plus additional jobs, plus the thing that really can't be measured is the tourism that we'll bring here and the traffic we'll bring here. When I say traffic, I just mean additional cars. They'll
Right.
be going to the local businesses.
Right.
They'll be buying lunch and coffee
Right.
and gas.
Right.
And that's what you can't measure in something like this, but we
Right.
know that there's a tremendous amount of indirect revenue
Sure.
that's going to come as a result of this.
Sure.
It's good for everybody.
Sure.
We've done this at our other locations over the past 7 years.
Now, how many? We talked about this before, and since I honestly got his name wrong, which is terrible. I feel so bad because I do remember his face so well, and I remember your store so well. How many other locations do you have?
We have one location, but it's co-located just like what we want to do here.
Okay.
So it's in Brockton.
Yeah.
We see medical and adult use.
Yeah.
Now remember.
Different area, Brockton than Cape Cod.
Yep. It's a city. It's I think it's
Yeah.
the sixth biggest city in the state. We've had no police issues.
Yeah.
We've had no fire issues. We've had no building issues.
Nothing there either.
No fake IDs. Nobody trying to get in. It's very organized.
Yeah.
It's probably one of the most regulated industries in the state, next to maybe running a healthcare facility or a
Right.
nuclear power plant. But
Ours isn't running so well, I don't think, right now.
But we're governed by the local municipality. We're governed by the Cannabis Control Commission.
Right.
So there's really two bodies that oversee what we do.
Right.
Significant investments, Adam can tell you, are being made into these businesses. And we want to make sure that we run them correctly. I mean,
Sure.
it's a responsibility. It's a privilege to get one of these licenses. And, we want to make sure that we run it in the best manner possible
Sure.
and give back to the community as much as we can give.
Right. So you also worked with Mashpee, is that correct?
I mean, we basically, where there's a ban, so I founded a group called regulateCapeCod.org.
Right. Yeah.
Bridging that to cannabiscapecod.org, hopefully, more of an industry-focused group.
Yeah.
But yeah, essentially, we go where we need to go. So,
Right.
If there's an appetite from the town, whether it's town leaders or people within the town, we try to get involved and use tried and true tactics that we've been using for years, to help galvanize supporters, get awareness out there. And
Well, a question's going to be, will there be more crime? Will there be, obviously Sandwich is a crime, ridden place, but although there's a little bit. But that's what people think. They think, oh my gosh, this is going to be like, some side street in Roxbury. That's not what this is all about.
Right,
And
no,
you
it's
and I
about-
know that sitting here, but there
It's
are
about
people out there.
reducing that.
Right, it's about reducing that.
Exactly.
So Mashpee opened a recreational, and there's been a lot of talk about the fact, well, they said they were going to give us all this money,
so,
and they didn't.
Mashpee is I would say not a very welcoming, town. They, first off, think about the location differences, still on 130, right? Cramming it off into Echo Park with no signage, right?
Right.
Like, that's not where a retail business, should be
No,
from a
yeah.
zoning perspective.
Right.
That's just
Right.
so
Right.
but put it off in the middle of nowhere and then complain that they didn't make enough money.
Right.
After dragging their feet all the way through June and then give them an approval,
Right.
and then 143,000 since that approval in June. From June to
Right.
December, I would say that's quite good in considering what
Right.
are you expecting the business
Because
to do?
you can't advertise it.
You can't. It's hard. There are advertising restrictions. It's not like you can just throw up a billboard, and there's some challenges with awareness.
Right.
And they had already had some awareness challenges of people thought they were open, but then
They weren't open.
it took so long, and then
Right.
people just kind of put it out of their minds. Found an alternate. Went
Right.
to Wareham, went to Verilife. And
Right.
they've changed their behavior.
Well, so, with anything, marijuana may be a little bit different, but with anything, whether you go to a certain coffee shop every morning or you go where you feel comfortable.
Right.
So if you've already started going across the bridge to Wareham, you're probably going to continue that
Right.
because as you pointed out, Jenny or Molly or whomever who sees you when you walk in, says your name and says, oh my gosh, hi, how are you, how you doing?
What's interesting now is there's over 200 retail stores in Massachusetts.
Wow, I had no idea.
This is becoming a convenience purchase.
Sure.
It's becoming a price-conscious purchase.
Right.
The more stores that open, it's better for competition. It's better
Sure.
for our consumers. But this business, when we had the opportunity to get the most out of it, right?
Yeah.
We wanted to be first to market in a community.
Right.
The balloons and the limelight, that's kind of subsided now.
Yeah.
And it's more, you have an opportunity to
Yeah.
still take advantage of a opportunity here because we're already built out. So I don't
Right.
need a long period to renovate my store, get
Right.
a new space.
Right.
That's an advantage Sandwich has. The disadvantage is if this doesn't pass,
Right.
you're looking at years
Down the
before we
road.
would reconsider this.
Right.
And by then you'll have 20 more stores around your towns.
Right.
And then what happens
In
is-
surrounding towns.
Correct. And
Yeah.
then what you're going to have is somebody like Adam, somebody like myself, who either live in Sandwich or a nearby community say, can't go there, I'm going to drive to Eastham. And guess what? Mike in Eastham is a really nice guy. I talk to him. We talk
Right.
about the kids when I go in there. It's my friendly place.
I see.
That's where I go.
I see.
And then Sandwich opens up in 2025, and nobody
Right.
cares because
There's already, all the way around there,
we've already
already shop.
established a
Right.
big marketplace.
Right. So what tells you that you'll bring in this kind of revenue? I mean, there's no guarantees in life, we know this. What are you basing that on?
So we're basing that on actual statistics of the stores in the area and actual statistics of what we've done historically in the city of Brockton. We know that we're going to see 3.5 to 4 times adult use rec patients versus medical. We know what we contributed in host agreement fees in a 12-month fiscal year to Sandwich. We would just multiply that by 3.5 or 4 more people. That's only your host agreement fee.
I see.
Now, remember, on your adult use recreational
Yeah.
side, it's a 20% tax, of which 3% goes back to the community from the Department of Revenue. We know what that number is going to look like. We know our
Right.
average sale, about how many people are going to come.
Right.
So
That's how
we
you
fi-
figured it
That's
out.
how we figured it out.
Right.
So
you've done your due diligence and a really good business plan.
yeah, we have a great business plan. We really enjoy being in the community. It's been a little challenging at times trying to get open, but now that we're open, the community's been, I would say, very warm and accepting to us, and things that we've needed.
Well, you wouldn't even know, no offense, that you're even there.
Nobody knows
There's a
we're there.
little tiny sign at the.
We had a nice
drive.
big banner, but they made us take it down. Not allowed that. But no, it's been a great opportunity.
Right.
It's been very successful. We would like to see the adult use pass. It would be great for our business. It would be great for our community. It would be great tax revenue. I compare it to, like, if you could have a liquor store in town.
Right.
Could you imagine only being able to sell beer and wine
Yeah.
versus a full liquor store?
Right.
Now, I'm only able to sell beer and wine, which is my medical component
Right,
of the business.
right.
I think the other piece, and Adam can probably touch on this, is there's a lot of 21 plus people who utilize marijuana for medical reasons, but don't have a card to get into a medical shop because, one, they're either a veteran, and that could be a problem.
Really?
Yeah, so the VA does, historically we've seen that the VA frowns upon medical marijuana cards. I know of people that have had medications restricted because they've had a medical card. You have this thing about people with gun licenses or not, whether they can own a medical card.
Right.
You even have businesses that are restricting employees through drug testing still.
Right.
That won't allow them
Right.
to have that. So the recreation gives
Well,
a
you don't want
portion-
somebody coming to your place of business working high as a Georgia pine.
Correct, but they should be able to go home after work
Right.
and utilize medical marijuana just
Right.
like another medical patient. What I'm
Right.
talking about is not during the day, not
Right.
driving,
Right.
compliance, regulations that we
Right.
follow.
Right.
If I'm a CDL driver, I can't have a medical marijuana card.
Right.
But I can go into an adult use shop and make
And
a
buy.
purchase. Yeah,
Yeah.
and I have to.
I mean, that's the key difference, right? A medical, you're tracked.
Right.
Every purchase tracked. There's only a certain amount of quantity you can buy. You're all tracked very heavily. On the adult use side, I mean, it's in Massachusetts, the anonymous sale is protected. So the idea that this, person can go in and get the medication they seek without being tracked. I mean,
Right.
that's a big benefit.
Well,
of the
and
adult
let's
use
face
side.
it, a lot of them are doing it to get high because maybe they don't drink. Maybe they,
Right, I'd say
it's
it's a much
a
better
different
alternative, right? Like,
recreational
yeah.
drug as alcohol is,
And that's certainly why I gravitated to medical cannabis. In my younger years, leaned on alcohol too much, and it's bad decisions. And I'd say my trajectory in life was impacted when I switched to cannabis. I mean, honestly, life became a lot easier. So I do advocate for medical cannabis and for people to explore that, especially as an alternative to other substances that they might be
Right.
using as a crutch. My first medical purchase was actually in David's store in Brockton.
Yeah.
Like the first purchase I made with my medical card. But again, it was about me and my life. I was in my 30s
Right.
and I was in.
Well, it should be an
position to
individual choice,
Right.
obviously.
So exactly.
Yeah.
People should have the choice for legal access.
Right, and just because a store opens in Sandwich sandwich doesn't mean that all of a sudden everyone in the community starts using marijuana. Like,
You wish, but that won't happen.
that's not how it works. So you have people in this community that have medical cards.
Right.
You have people in this community
And we
that-
don't even know who those people are, do
No,
we?
no. You have people in this community that purchase recreationally.
Yeah,
right?
yeah. They go
and then-
across the bridge.
Then you have a vast majority who don't use it,
Right.
which is fine.
Well, you've got an older population here. Now, I'm a product, I graduated high school in 1967. Yes, I'm old. And you know what? It was everywhere. However, there was a certain period of time that nobody did it. So people my age, they're either going to go back to it or they're never going to take it up again.
Right.
I mean, and you're in an older population area.
Yeah. And we see an older population
Yeah.
shopping with us, both in Brockton, both in Sandwich.
Yeah.
I think people would be pretty surprised if the demographics of our industry really got
Well,
out there.
I think that's interesting, though, what the demographic would be,
Yeah.
you know, age-wise. You know, we all think of 22-year-olds to 28-year-olds.
Oh, yeah, no.
And I'm sure it's older than that.
Yeah, so I mean, you got to remember that our products are regulated,
Right.
tested, packaged. There's a cost associated with that.
Right.
So you do pay a premium to shop in a store, but the satisfaction and the mindfulness that you're buying a safe, consumable product.
Right.
makes-
And that would be the same with the recreational as
Correct,
well.
which is why you're not seeing a tremendous amount of younger people shopping in these stores because it's expensive.
Right,
Prices are coming down.
right. Right.
And you'll continue to see prices come down
Right.
as more people open in the marketplace. But you know, you pay a tax, you pay to have a regulated
Right.
business that's safe for people.
Is the tax on this more than on alcohol?
It is, yeah.
And it's making more at the state level. So everything David's sharing about his own individual projections, right, are now you get all this great aggregate data coming out at the state level, and it's it's verifying all of this. And some recent numbers that WCTV put together was. Cannabis in the second half of the year pulled in $71 million in tax revenue compared to only $50 million in alcohol revenue, and that's statewide, and that's 200 stores versus thousands, right?
Right.
And
One
so
on
there's
every
this-
corner.
Right, and there's this so there's this giant demand for this product, right? And the higher tax revenue makes it more appealing for municipalities, but from the individual's perspective, you got all these new people coming in trying it for the first time in a long time or
Right.
ever,
Right.
and the worst thing is when that first experience occurs on the illicit market, you don't have the choice, it's not tested, you don't know what it is. When you can go in the store and actually have it be educated on the variety
Right.
of products,
Because the people you
that will work for
hire, you educate them on what would be appropriate for individuals.
Training is very important because the last thing we want to see, or anybody in our industry wants to see, is somebody coming in having a bad experience.
Right.
I don't mean shopping. I mean going home
And,
using
yeah.
our product not correctly. So
Right.
if you went to your doctor and you were prescribed opiates, you follow the care plan that the
Right.
doctor developed.
Right.
If you weren't to follow that, you would have bad outcomes.
Right.
Speaking of that, we've had people come in and say, it's a blessing that we have access to adult
Mm-hmm.
use marijuana, recreational marijuana. I'm not on my opiates anymore. I was
Right.
able to get off of this.
Right.
I use this instead. It's changed people's lives.
Yeah.
We've heard it saves people's lives, I mean, we know
Well-
opiate addiction is a problem, and
Yeah, a
medical
terrible
marijuana
problem.
played a great role in helping to reduce that over the last, since 2015 when we opened. Now you're seeing the adult use as an option for people will also help pull that opiate problem away, hopefully.
Well, I'm getting a new knee, so I'm very excited. I'm going to be a bionic woman.
Yep.
My left knee.
Nice little topical for that
Yeah.
post-surgery.
Well, I actually have a topical I use
right.
now to help with that. However, that said, that's the thing that scares me the most is the painkillers.
Yeah.
And everybody, it scares the life out of me. And why? Because I don't like to take pills. I'm not a pill person, but I also don't like a lot of pain. So it'll be interesting to see how that all comes about, how it works for me. My son, who has a medical marijuana card because he has Lyme disease, and he's been in the hospital with it, in fact. And I have to laugh because he's brought me over 2 cans, just 2 cans of, it's like a seltzer.
Yeah.
He goes, now save these, Mom,
Yep.
for when you get home, and don't take any drugs, just drink this.
Smart guy. It's a great entry-level product. That's exactly.
He was very funny about it. Of course, my husband was going, you got to be kidding me. But we laughed about it. But I still have them in the fridge.
Yeah.
So,
That's great.
You know, there's so many products out on the market
Yeah.
now that are produced by the vertically integrated companies in Massachusetts
sure.
And just the freestanding manufacturing,
Right.
Cultivation facilities. It's not just about smoking a joint. There's vaping, there's edibles, there's
Yeah.
topicals, there's drinks.
oh, don't vape. It's bad for your lungs. It's bad for your lungs.
Yeah, well,
Eating is bad for you too sometimes, but
yeah.
I'm just
So
saying,
we
vaping
see
is
a lot
terrible.
of. We see a lot of sick people that come in the door,
Sure.
who suffer from all different types
Right.
of,
And I know I have
unfortunately,
friends who've had cancer
and
and-
MS, and PTSD,
Right.
and they all find something that works for them. You know,
Right.
a lot of people don't want to smoke; they go to edibles. A lot
Right.
of people traditionally like to smoke because it's a quick onset and it helps relieve pain. And there's something for everybody.
I have a friend who has an aunt who is, gosh, she must be in her mid-90s, and she has terrible arthritis, her gnarly hands, and it's just very sad. And she was over there to have lunch with her and fix her lunch and talk with her and whatever, and she puts out her little gummy, and Mary Alice says, "What's that? Is that a vitamin?" You know, whatever her name. I don't remember her aunt's name. And she said, no, that's my marijuana, so to help with my arthritis. And of course, my friend she started laughing out loud. She goes, who would have thought a 90-some-year-old woman? But
yeah.
there you go. That just kind of goes to prove. I'm not endorsing this one way or the other.
Yeah.
However, I think everybody needs to have the choice to be able to decide what works for them in their situation, in how they live. And I would imagine this is a part of that,
Yeah,
I think.
yeah, no,
Absolutely.
you're right.
And you have kids and you're not worried about it.
I mean, you know, my kids are 2, 5, and 8, right? So,
Yeah.
you know, there'll be, you know, certainly conversations we'll have as they get older, you
Right.
know, and it's, you know, it's all about, you know,
Sensibility.
responsibility, you know, and hopefully, have the conversations that I didn't have as,
Right.
you know, a kid who grew up in the
Right.
80s and 90s, and
Right.
just all this is bad, you know? and
Right.
then, you know,
Right.
So, looking forward to those conversations.
Well, good. Thank you, Don. And Adam. I was so bad with names today. I do apologize. Again, I apologize. But thank you for coming on. Thank you for explaining it. I will be looking forward to having this money go into our tax revenue. I will. I hope it
We look forward
happens.
to generating it
Yeah.
and giving it to the community.
Excellent, excellent, excellent. Do you give to nonprofits too, or no?
We do.
Yeah?
So we do support local charitable organizations
Great.
down here. We have some great relationships with some domestic violence programs
Yeah.
that we contribute to.
Yeah.
We do some nonprofit work with some of the with some of the shelters for
Yeah,
animals
good,
down here.
good.
We do a backpack program for kids in
Good.
foster care. So
Nice.
you know, we
Excellent.
give back as much as we can.
Good, good. Thank you so much. Thank you both.
All right.
Wow, all the information you ever wanted on recreational marijuana. They were here to talk about it, to let us know that it will be on the ballot at the May town meeting. It's a very, very important topic. I think they were very rational in their reasoning, and let's face it, having an extra $750,000 to $1 million come into the town coffers in taxes wouldn't be a bad thing. However, I know that there's going to be lots of different opinions. Just show up to town meeting and vote one way or another. So thank you for joining me. I'll see you next time on another Cape Conversations.
The views expressed in this program are the views of the host and guests and do not necessarily reflect the opinions of the SCTV staff or board of directors.